Hey guys, I gave you a tease earlier this week that I was going to drop a podcast on here that I listened to last weekend that's phenomenal and perfect timing because it follows up the webinar that we just did a week ago about all of the holes that are left in your thought processes and your skill sets after you graduate PT school. So you thought 7 years of college, 3 years of grad school, 4 years of higher education, becoming a doctor would allow you to be an effective clinician. And now that you're out there, some of you within 6 months, some of you within a year, some of you it takes about 2 years to figure out that you don't know what you're doing. Because PT school didn't teach you the important things, it just left you with massive holes in your skill set. So I know I put a lot of blame on PT school, but it's not just PT school. And that's the reason why this podcast resonates so well with what we've been talking about. So this podcast is going to be talking about how the conventional medical model of medicine and med school is just as bad, just as corrupt, just as money grabbing as PT is. Okay. So I'm going to post, I'll post the link for the podcast below. It's Casey and Callie Means, who are brother and sister, and they're on the Joe Rogan Experience. So I'm going to post the Joe Rogan Experience down below. Now, if you've listened to Joe before, you know it's going to be a 3-hour podcast, which is great because he's going to dive deep and let them dive deep into their experience. One, going through med school, getting out of med school, working in the broken system, pushing the broken system without thinking about what they're doing, which is a lot of what you are doing. Going through PT school, getting out and pushing PT, then realizing this is bullshit. And what they've done, the hard work that they've done, disassembling or taking apart the medical model and finding out where it's actually coming from. So they're going to cover this history of medicine and where it's coming from, who's been funding it, and with anything, follow the money and you'll find out where the true goal and the real true purpose of something is. So we're gonna break that down for you. But I want you to just watch and listen to the parallels between med school and PT school, medicine and physical therapy. Both extremely flawed, both driven by greed and money by the higher ups that are going to push everything out. And it doesn't matter what's going on with patients, what kind of treatment patients are getting. It's all about making money, pushing narratives, making money, pushing narratives, and making money. And if people get run over in the meantime, not a big deal, as long as our stockholders, our shareholders, our board is making money. Okay, so I want to talk a little bit about some of the highlights here. So they're going to get into the root cause. So I think it's Callie that gets into root cause of medical dysfunction, just like I get into root cause of orthopedic pain and injury. And if you get to the root cause, you don't have to waste your time with all the other stuff. But what you're finding out and what Callie will tell you is if you don't push the narratives of medicine and you actually get to the root cause, it's way easier, but it doesn't fund the system. It doesn't make pharmaceutical companies any money. So that's not what you're taught to do, because who drives the education system in the medical scenario? Pharmaceuticals, big medicine, hospital organizations. Do they want people to get better faster and stay better longer? No, that doesn't feed their bottom line. Just like physical therapists that have somebody come in for an eval and they tell them, well, you better schedule 2 to 3 times a week for the next 6 to 8 weeks. That's basically telling people that they're not going to get any better, but I'm going to make as much money as I can before you figure out that you're not getting any better, and then you leave and go somewhere else. Okay, so they're going to get into root cause. They're going to get into evidence-based practice, which is phenomenal because they're going to say the exact same thing that I've been saying when people post on my Instagram reels, when I'm talking about physiology, neuromuscular physiology, which is not open for debate, it's fact. And they keep on saying, well, where's your evidence-based practice? I don't waste my time with evidence-based practice, and they're going to talk about the corruption of evidence-based practice. They're also going to talk about siloing and how in med school you're taught to silo. In PT school, it's called differential diagnosis. So you're supposed to get to a specific diagnosis so you can prescribe the protocol of the stretches and exercises that go with that diagnosis. Don't apply any critical thinking. Don't get to the root cause. Don't apply neuromuscular physiology and actually solve their problem, which is unique for each individual, which is actually way easier than trying to silo people and then trying to jam a square peg into a round hole and give them the 5 exercises and 4 stretches that go with this diagnosis and then wonder why on visit number 6 they haven't made any progress. So they're going to talk about siloing. In our world, that's called differential diagnosis. They're also going to talk about tribalism and how when they left the broken medical model and they started going against the false narratives and started exposing people and exposing institutions for what they're doing, the tribe didn't like it and it pushed back. So just like what I'm doing, I've told the tribe, you suck, you don't work, I'm not following you, I'm not doing your crap, I'm not pushing your false narratives. And so what did the tribe do? They push me out, which is totally fine. So it takes courage to stand up and be the only person that's saying you shouldn't be stretching, you shouldn't be foam rolling, you shouldn't be doing myofascial release, corrective exercises don't work, cupping is bullshit, dry needling is bullshit, there's no such thing as subluxations. So it takes courage to stand up and say that, just like it took courage for them to say, hey, there's a much better way to do this than just pushing pharmaceuticals and sending people in for surgery. So when you're ready to break out of the tribe, and remember, the tribe, the top tier of the tribe are the pharmaceuticals and big medicine and the APTA and PT schools that have all the money to drive all of the people down below to do what they are told to do because that's what's expected. So if your PT school told you, do this, and you asked why, and they said because that's what PTs do, that's what patients expect, that's what physicians referred them for, tell them, F you, I'm not doing that. Get out of the tribe. But it's going to take courage. So if you don't have courage, you probably should just stay in the broken medical model and get frustrated and burn out in the next couple of years. They've also talked about how, now think about this. Take a look at when you walk into a PT clinic, think about all of the modalities that you see. STEM, traction, ultrasound, lasers, all that stuff. Think of all of the new gimmicks and gadgets that you see. Theragun, needles, cups, K-tape. Think of all the BS that we've been doing that actually violates physiology, stretching, massage, soft tissue release, myofascial release. Think of all that stuff and think of the results that we get now versus the results that we got back in the 1950s. So in the 1950s, we had similar modalities. We might have had heat lamps and some other things, maybe E-stim, that kind of stuff. Has adding more crap to what we do, putting more garbage into our toolbox, made us any more effective? No, it hasn't. Just like with medicine, the more crap they've added hasn't made anybody better. It's actually in some cases made people sicker and worse, which is what they'll cover in the podcast. So think about it. If we're adding things, but those things don't get to the root cause, and those things are not based on physiology, anatomy, biomechanics, those things that drive function, then are we really making our profession any better? Are we really helping our patients get any better? No. All we're doing is adding more noise for you guys to trace more certifications and chase more continuing education classes and post goofy shit on social media saying, look at me, I put cups and needles and K-tape on somebody. Does that mean they're better? No, that means you filled their head with more garbage because you didn't take a step back, take garbage out of your toolbox, get back to science and be guided by science. So the further we've gone, the more crap we've added, and we've made ourselves even worse and our patients even worse, when what we should be doing is getting rid of crap, taking stuff out of our toolbox, stop going into continuing education classes,
review the textbooks that are centuries old that show what has been proven and get to the root cause and reverse that. So they're not gonna get into PT related things, but listen as they talk about the way that medicine has progressed. And the more complicated it's got, the more it's gotten away from root cause and patient care and gotten more towards who's gonna make more money. Do you think that the guy that made Theragun to get patients better? No. You know why? Because he doesn't even know what neuromuscular physiology is. He knows that if I put this shit on your arm and it bounces back and forth and it vibrates, it feels pretty good. And if I can mass produce it, I can become a billionaire. He didn't think if I put this crap on your arm and it bounces, that's gonna fix the root cause of your problem. No. Did you think that the person who came up with cupping did the same thing? No. Do you think that the people that are teaching continuing ed classes based on dry needling are teaching that because, hey, this is fantastic for patients and patients are going to get better so much faster that they're only going to have to be coming into PT for 1, maybe 2 visits? No. They're thinking, I've got a bunch of people that want to learn this crap. I'm going to make a bunch of money doing it and they can post whatever they want on social media and look cool. That's what it's about. So that's what they're going to talk about as related to medicine. They're going to talk about how we got here. So they're going to get all the way back to when medicine started and what started the whole ball rolling. Who instituted the thought processes and strategies that we are building on top of. So we've continued to build crap on top of crap. We've never stripped it all the way down and said we're starting over, we're going after root cause, we're going after function, we're going after getting patients immediate results. What we've done is we've taken his work that I think was back in 1940 and what he instituted as the guidelines, and we lived on top of those guidelines, adding more on top of that, which means we just have layers upon layers upon layers of bullshit. They're also going to talk about the medical or the educational model. Who drives the education? If that's what you're learning and that's what you're forced to say in school, how in the world can you ever be a legitimate clinician? They're also going to talk about, and they actually mention boiling the frog. So if you don't know what boiling the frog is, if you take a frog and you put it in a room temperature pot of water and you turn that water up to boil and it takes 15 minutes to get hot enough to boil, the frog will stay in the water. It will not realize that the water is boiling and it will boil itself to death without ever knowing it. This is exactly what the broken medical model and PT school hope you do. They hope you graduate. They hope you pass boards because that's all. Once you pass boards, they wash their hand. They did what they were supposed to do. They're not supposed to make you a clinician. They're supposed to get you to pass boards. So once you pass boards, they wash their hands. I succeeded. I did my job. Now I've got all that tuition to show for it. Then the medical model is going to say, well, I'm going to boil this PT. I'm going to introduce them to a bunch of stuff that they should know better, but their head's going to be spinning walking out of school. They're going to be trying to juggle patients. They're going to be trying to see 3 to 4 patients an hour. They're going to be tossed all of these modalities that feel good. And patients will say, well, I feel better. And they'll boil slowly because they think people are getting better because they feel better. And we're going to make them forget that people aren't coming to physical therapy because they have pain. People are coming to physical therapy because they have a problem that's causing pain. We don't want you to think about that. We just want you to understand that people feel better when they walk out. So we're going to keep doing that 2 to 3 times a week for 6 to 8 weeks. And if they don't get any better, no big deal. We've already made money and we've got more people coming in because we took lunch to the physicians that send us patients. How jacked up is that? All right. So they're going to talk about boiling the frog and how you, if you're watching this and you know that you're not doing what you should be doing, you can't explain what you're doing without lying, and you know that your patients aren't getting better, but you continue to do that, you're the frog that's getting boiled. And if you don't make the choice to stop doing that and find somebody who can mentor you and get you out of the broken medical model and teach you how to apply what they never taught you in PT school. If you keep on doing what they taught you in PT school, you're gonna boil, you're gonna get frustrated, you're eventually gonna get burned out, and you're gonna give up, and your patients will never get any better. And they're gonna get towards the end, they're gonna get towards how we should be fixing this. And I've already given you the option of how we should be fixing this as far as the PT model, because I've given you the link for the shift. I've told you in 4 months, I can teach you what PT school didn't teach you. I can teach you how to apply neuromuscular physiology, how to take all that crap out of your toolbox and throw it away and actually do what you're supposed to be doing by getting out of the tribalism, standing up for yourself, having the courage to do something different and reinvent your career in 4 months. So if you're ready to do that, you should be ready to do that. And after you listen to this podcast, you should for sure be able to do that, because you can see that it's not just PT that's corrupt. It's everything in medicine. So the doctors that are referring you patients and telling you to do X, Y, Z with them aren't telling you to do that with them because that's what's best. They're telling you because that's what they were told to do by their broken medical model. And if you do those things, all you're doing is taking the bullshit from medicine and adding bullshit from PT and screwing your patients over. So listen to the podcast, post feedback, post comments, and get in the shift.